we're going to look at chapter 1 of our Human Anatomy and Physiology book. This chapter is just going to deal with a few of the basics, basically dealing with the basics of anatomy and physiology, doing a little history of who were the individuals behind the scenes of helping us get to where we are within the scientific field. So what are we going to learn? We need to learn the two definitions, anatomy and physiology. So let's know that you will see those two on a quiz or even on one of the exams. Also, you need to know the various ways of studying the anatomy of the body. Okay, also we're going to look at how to define a few of the sub-disciplines of human physiology. We're going to look at the description of inductive and deductive methods of obtaining a scientific knowledge, describe some aspects of experimental design that help to ensure objective and reliable results, as well as explain what is meant by hypothesis, fact, law, and of course theory when we're dealing with science. Alright, so when we look at anatomy and physiology, the book says it's about the human structure as well as the function. So we're dealing with the biology of the human body. So we want to know, how does it work? And of course we have some fundamental advanced studies within A&P in the healthcare area of exercise physiology. We have pathophysiology and other healthcare related fields such as cytology and histopathology as well. So let's move on to the remaining parts of the study. We're going to talk about anatomy. Okay, we are dealing with anatomy and physiology, but what is anatomy? Anatomy is the study of the structure and the relationships between body parts. I'm going to repeat that definition again. Definition of anatomy: the study of the structure and the relationship between body parts. And we had different ways of examining the body. We have palpation, auscultation, percussion, and inspection. Now you may have heard some of these words before. When we talk about palpation, we're dealing with the method of feeling with the fingers or your hands, doing any type of physical examinations when the doctor is just maybe just touching the outer aspects of your face. If you feel you have a sore throat, the doctor will palpitate your tonsils on the outer aspect around the lower part of the back part of your jaw, the superior or the upper portion of your neck, just to see if your tonsils are swollen. Then we have auscultation. We're dealing with listening to the internal sounds of the body, and you're going to be using a particular type of instrument called a stethoscope. So we may listen to bowel sounds. Let me have you in a supine position, and they'll have the stethoscope by the stomach listening for bowel sounds, as well as for breathing and heart sounds as well, on your back as well as on your chest. Then we have percussion. Percussion is basically tapping the body parts with your fingers, your hands, or any type of small instruments, also done through a physical examination. Then we have inspection. Inspection is basically giving a visual observation of the body parts during a physical exam. Of course, with inspection, you will have certain things that you can observe if there's swelling, discoloration, deformity, those things that you will inspect. Alright, some other ways. We have cadaver dissecting, and that's of course dealing with cutting and separating of tissues to reveal their relationships. Then we have comparative anatomy. We deal with the comparative anatomy. We're going to be dealing with bodies of more than one species, and we're going to be figuring out what type of similarities or differences that they have, okay, and how they will evolve, the evolutionary trends that they may have. Alright, then we have some more definitions. We have exploratory surgery, and that's how That's how we know. Let's deal with the open body and taking a look inside of it. Just dissecting it, looking inside the body, and seeing exactly where the various organs or various structures are situated. They have medical imaging. We know medical imaging. We're dealing with radiology, X-rays, MRIs. That's our medical imaging is viewing inside the body without surgery. We have gross anatomy. It's a study of structures that can be seen with the naked eye. So we're looking at the heart, the bones, the lungs. Then we have histology, and that's the observation of tissue specimens using a microscope. We have, and underneath that, we have cytology, we have ultrastructure, and histopathology. Right, histopathology is basically studying tissues for any signs of disease. And when we look at cytology, the study of cells, of the individual cells, of course, under a microscope. And we have ultrastructure, which is the fine detail of tissues revealed by the electron microscope. So when we look at physiology now, we already talked about anatomy, which is the study of the structure and the relationship between body parts. Now we're looking at physiology. Now, physiology is a study of the function of the body parts and the body as a whole. So basically, how are these body parts working together to ensure that we have homeostasis, make sure everything is working or functioning the way it is working, or even if there is a type of disease, how is it working during that disease state or virus state. So we have some subdisciplines. We have neurophysiology, endocrinology, and pathophysiology. When we look at neurophysiology, we're dealing with the physiology of the nervous system, hence the name neuro. Deals with the nerves, and physiology, of course, we're dealing with the physiology, the study of the function. Then we have endocrinology, the physiology of the hormones. And pathophysiology, we're dealing with the mechanisms of a disease. How is a particular disease, how does it actually work in the body on a physiological level. Now we have comparative physiology. We're dealing with comparative physiology. We're dealing with the study of the biological functions of different types of species. And it's often the base of new drugs, and of course with new procedures. And when we study these different species, we might look at animal surgery or as well as animal drug tests. Alright, so let's take a look at the various scientists that played a role in where we are today within the field of science. Now we know that the Greeks and the Romans, they have a legacy that begins way back with Hippocrates. Now Hippocrates in Greece, he is considered to be the father of medicine. Okay, and he established a code of ethics called the Hippocratic Oath, and that is basically the urge physicians to seek natural causes of disease rather than attributing them to various gods and demons. Because back in the Greek days, they always thought that diseases or any type of warfare or anything negative came from the gods like Zeus, and I'm not too familiar with all the Greek gods. I remember Zeus, but all those various gods that they worshipped. Then we have another gentleman called Aristotle. Of course, he's from Greece, and that was around 350 BC. And he tried to identify unified themes in nature. And he's one of the first physiologists to write about anatomy and physiology. Of course, he believed that diseases had either supernatural causes or physical causes. When he dealt with the supernatural causes of disease, he termed it, or it's termed um, theolo theology, and from natural causes called physiology. So that's where we have physiology, that word coming from based on natural causes. All right, then we have another one called Galen, Claudius Galen or Galen. He is from Rome, back in the not 19, but 106 BC, and he wrote the noteworthy medical text of his time, and he was the physician to the Roman gladiators, and he did dissect animals because they prevented him from using human specimens or human cadavers to do his dissection at the time. They actually banned him from doing it. He actually saw science as a method of discovery, not just a body of facts taken on faith. And he wrote a book advising followers to trust their own observation more than the teaching of dogma of the ancient masters, because he realized that a lot of the theories a lot of the theories that the scientists prior to him were making or stating were incomplete or incorrect. And he decided, you know what, it's better to dissect and observe on your own as opposed to just going off of what somebody says. And that's the same thing with this class or any class that you take. Don't just take the instructor's word as is. Always go back and read and do other research into that particular topic so that you're well-rounded. If you have any further questions, you can actually ask questions. You can either, and of course you can add to the discussion. Sorry, I kind of went off a little bit. All right, so we look at the birth of modern medicine. It began in the Middle Ages, and of course it continues to present day. Now, the Christian culture of Europe in the Middle Ages, they severely repressed any type of scientific study. They taught medicine primarily as a dogmatic commentary on Galen and Aristotle, and they had crude medical illustrations. Of course, we deal with the other individuals. The Jewish physician Moses ben Maimon, he wrote 10 influential medical texts, and he was the physician to Egyptian sultans, to the Egyptian sultan Saladin. All right, so we have this other gentleman who taught anatomy in Italy, Andreas Vesalius. Now, the Catholic Church, they relaxed the restrictions on dissecting of the cadavers, and they permitted him to use cadavers to help with observing and predicting any type of diseases that were coming about at that day. Now, we do have something called barbering and surgery. They were considered kindred acts of the knife. Also, this gentleman, he actually found that most of the anatomy of what Galen was doing was incorrect. And he decided to publish the first atlas of the anatomy in 1543. Now, William Harvey is basically one of the earliest physiologists, and he made contributions to represent the birth of experimental physiology. Now, Harvey and Michael Servetus, they discovered the continuous circulation of blood. So they're dealing with blood circulation, which is good. And they realized that blood flows from heart and back to it again. And he published his book called De Moto Cordis, which is the motion of the heart, back in 1628. And here's the other gentleman, Michael Servetus, who, along with Harvey, helped us to realize that the blood does circulate continuously around the body. It goes from the heart to the organs and, of course, back to the heart again. Basically, what we already know of how blood circulates throughout the body. Then Robert Hooke. Everybody should know Robert Hooke because we've hopefully have dealt with it back in in high school. Robert Hooke, he designed the microscopes and was able to view various cells. So he helped improve the compound microscope. So we have two lenses. We have an ocular lens, which is the eyepiece that you look through, and then we have the objective lens, is the ones that's closer to the specimen. So here will be our ocular lens up here, and this will be our objective lens down here that we can actually look through. That looks through closer to the specimen. He invented the specimen stage, as you see here, the illuminator, coarse and fine focus controls, which, as we know, if you've used a microscope before, is very, very handy. Otherwise, the specimen looks very blurry. Now, his microscopes, they magnified only 30 times. Now, and it was the first to see and name cells. We have a few more individuals. We have Lewin van Hooke, Carl Zeiss, and Ernest Abbe. When we deal with Lewin van Hooke, he improved the magnification of the microscopes so that we're able to about 200 times. And he published his observations of blood, lake water, sperm, bacteria from tooth scrapings, and many other things. Now these last two, Carl Zeiss and Ernest Abbe, back in the 1800s, they improved the compound microscope, and they added condensers and superior optics. We have Schleiden and Schwann. They also helped improve the microscopes, and the examination. They helped with ensuring that we had a wide variety of specimens, that could have been examined, and to conclude that all organisms were composed of cells. And they were the first to tenate the cell theory, which is considered as the most important breakthrough in biomedical history. Realize that all functions of the body are interpreted as aspects of cellular activity. So make sure you guys know that these gentlemen here are the ones that helped come up with that cell theory, the first tenet of the cell theory. Now we're dealing with modern biomedical science. When we deal with biomedical science, what are we dealing with? We're dealing with technology advances. So we've come a long way when it comes to medical or technological advances in every area. Look at the cell phones. Look at the televisions. We used to have typewriters. Now we're here computers or iPods. We used to have land phones, and now we're cell phones, and some watches. You can actually talk on some watches. I just saw someone the other day. But we have come a long way, and especially in the medical field. And these advances are enabling us to save lives and help people to live longer, and diagnose various diseases a lot earlier. Okay, because back in in earlier years, they will see that someone may have been dying or may have had gangrene or some type of disease and may have amputated the foot as opposed to treating it with some type of vaccine to get rid of the disease. Okay. Genetic revolution. We have human genome. This time that it was finished. We're dealing with gene therapy. And that's being used right now to treat various diseases. We have earlier pioneers that were extremely important. Yes, they did make mistakes. Some of the theories were wrong, but you know, when you're starting off or now learning about a particular topic or learning about anything new or establishing anything new, you will make mistakes at first, but then you have to be able to learn from those mistakes and make the proper changes so that you can progress as well as people can learn and help you or branch off from what theories or notions you may have had. Okay, and now we have these various laws that have stemmed off of the mistakes that they've made, such as the Hippocratic law, or even HIPAA, making sure the information that is the patient information is kept confidential and not given out to any and everybody. So we've learned from their mistakes and we have made proper advances so that we do not repeat what was done. Okay, so let us look at the scientific method. We deal with the scientific method. We're dealing with a little bit of history again. Back in Europe during the 1600s, Francis Bacon and René Descartes, they reviewed science as capable of being a scientific method of study that would have enormous implications for human health and, of course, with welfare. Now, the scientific method is a combination of disciplined creativity, careful observation, logical thinking, and honest analysis. Hope you got that. I'm going to repeat it again. The scientific method is a combination of disciplined creativity, careful observation, logical thinking, and honest analysis. So that's 4 things dealing with scientific analysis. Now, when you look at Francis Bacon, he made a number of observations until he says that making numerous observations until one becomes confident in drawing generalizations and predictions from them. And obviously dealing with the knowledge of anatomy obtained by this particular method. So it's just like if you are testing a particular theory. Let's take the Ebola virus right now. The Ebola virus, we know that it spreads. We know the very symptoms that it has. But how do we know what will actually work to cure it or actually heal the individual? Instead of testing or giving a treatment to one person, and this treatment works, or to say treatment A to a particular individual and see that it works, we can't just give that same treatment to person 3, 4, 5, and 6 thinking that it's going to work. We have complications. There may be certain things that may not interact with the other patients that may harm some. So what you do, you have to keep testing and testing and testing and testing until we are confident that that particular antidote actually works. So you have to test it on various animals, which is what's appropriate, not testing it on adults, on humans, but you'll test it on various animal specimens just to make sure that that particular virus or that particular antidote works. And you'll test it a number of times. A lot of these drug companies, they will test these things for 2 and 3 years just to make sure that the particular antidote that they have works, and to be sure of the various side effects that will occur. And so we have various commercials that yes, this particular drug is good for it's also for erectile dysfunction or heart disease or for asthma. And what happens at the end of the commercial? What do you see? Oh, it may cause liver function disease, liver disease, blurriness, slur speech, blurry vision. But there's all side effects. But they have to test all these things a number of times to make sure that what they are giving us is correct and we are aware of the side effects. So proof in science, it must have a reliable observation, must be tested and confirmed repeatedly, and not falsified by any credible observation. A lot of some scientists will actually fudge the information so that they can get FDA approval, knowing that it's not going to be beneficial to the patients or to anybody else. They just want that money. So they'll falsify the information or documentation. They'll actually falsify the amount of patients they've used. And they'll change the numbers here and there on their results. So that's what we're talking about, falsifying the information. Now, in science, all truth is tentative. Proof beyond a reasonable doubt is what is obviously needed. All science, in science, all truth is tentative. So that means basically it can change. It can change. Even with the seasons, even with various drugs, things can change. Alright, so let's look at the hypothetical deductive method. Now, this method involves formulating a hypothesis, and that's a possible answer to a question, and then making observations or performing various tests to support or even to refute the hypothesis. Okay, so when looking for a good hypothesis, you want to make sure that it's consistent with what is already known. And then you have to make sure that it is testable and possibly doesn't have a lot of false evidence. Okay, so when we look at the word falsifiability, means if we can claim something is scientifically true, we must be able to specify what evidence it would take to prove it wrong. So if you have scientific method or scientific proof saying yes that this is working, do you have a scientific method to prove me wrong? That's basically what it's basically telling you. So I want to I'll show you guys after. When we look at the sample size, when we look at a scientific journal or journal article, not an article you see in the newspaper, but from a journal, scientific journal, you will notice that they have sample sizes. And when they have sample sizes are basically the number of subjects that you have in the study. Some studies may use 15, some may use 10,000. All depends on what they're trying to test. And then you have controls for chance evidence and individual variations. When you deal with controls are the ones you have a control group and you have a treatment group, and you're going to compare the two. So you have a comparison of treated and untreated individuals. So the control groups are the ones that's going to receive that placebo or that fake substance or the fake drug, and the treatment group or the treatment group basically going to receive the real drug or the real fluids. We look at psychosomatic effects, those effects of the subject's state of mind on his or her physiology. Usually do with the use of a control group. Yep, and that's to make sure that they don't try to change or basically try to change what the outcome of your effect will be. So if you give a control group a particular drug, let me see if I can give a visual for this. Alright, so we have a particular drug that we want to give, or let's do Gatorade. Alright, so we're doing Gatorade to check on the performance of an individual or of athletes. So we have Gatorade and performance. So that's what we want to test. To see, does Gatorade actually work? Does it actually improve the performance? We see a lot of commercials and performance. Don't mind my writing, I'm sorry. Alright, so we will give Gatorade to the treatment group. Of course, when we give it to them, we don't give it to them in their bottles, the original bottles, because they know they're getting Gatorade. It'll be in a container, like it's maybe a styrofoam container, but where they cannot see the contents inside. It'll be covered. Of course, won't drink from a straw because then you're able to see the color of it. They'll actually put it to their mouth like you're drinking maybe warm coffee or tea from the store. They have a lid, so they'll have a cup with a lid, and you drink from that lid, and you don't know what you're actually getting. Then we'll give the non-Gatorade. It could be flavored juice. Sorry, flavored water. And this would be given to your control group. Now we want to make sure that the cups are covered, the lid and everything on it, just to make sure we don't have that psychosomatic effect where the control group may think that they're getting Gatorade, because you don't tell them what they're getting. You just ask them, hey, we would like you to take part in the study, and they just sign this waiver form and everything else, and they will just drink the juice and go through the particular tests that you had them going through. They're not going to know what they're going to get, but we have them in these particular cups, and that's just to make sure that they don't have the psychological effect like, oh, I'm drinking Gatorade, oh, I'm going to do better, or they're going to actually perform better based on psychological knowledge of what they're drinking. Because if you say, oh, you're just getting water, then they may not perform better. If you tell them, oh, you're getting Gatorade, then psychologically they might start performing better just because they heard of other commercials or other people saying, oh, Gatorade made me feel better, helped me perform better, just because. So we give them this placebo to ensure that they do not, just to eliminate the psychosomatic effect of the treatment differences. Okay? Alright. So we have experimenter bias. Experimenter bias is basically given a double-blinded type of study. When we talk about double-blinded, we're referring to the examiner or the testers. They don't know what is being given to who. So for the Gatorades, if I'm overseeing everything and I don't want my examiners or the testers to fudge the information, I would not tell them. I will actually prepare the Gatorades and the placebos and set it out for them, have it numbered, and I only know the numbering. They won't have access to the numberings. They will just write the numbers down as to, this is just basically just give the cups to the various individuals. Hey, this person was tested this time, and they'll have a record of it. But I would have the main record of who is actually getting what type of treatment, and that's to make sure that these examiners or these testers do not change any type of results just to satisfy their liking or to get access or even pass their dissertation or to change the results of the test. Okay. Then we have statistical testing. Now this allows evaluation of whether a result has occurred simply by chance. Okay. Now it does have the difference between control and a test subject that does not have a random variation. The results are due to a variable being tested. Now when we look at peer review is evaluation of a completed project by other experts in the field to help ensure honesty, objectivity, and quality of research. Now these are usually not published at this point in time, but they've completed the test. If you're working on your dissertation or completion of anything, depending on what field you're in, this is prior to you sending it off to get published by a particular journal. It'll be considered your peer review. Alright, so let's look at scientific fact. Information that can be independently verified by a trained person. So those scientists that have had numerous amount of research behind them, you can gather information from what they're saying. So that's my scientific fact that yes, Gatorade does improve your performance based on Dr. Smith or Dr. Wilson or I know doctors and their colleagues have come up with, because they have tested it numerous times and have come up with the same results. Then we have law of nature. The law of nature is a generalization about the ways in which matter and energy behave. Now, some laws are expressed as verbal statements, and those are considered to be law of complementary base pairing, such as law of complementary base pairing in DNA. Just verbal statements. And other laws are expressed as mathematical formulas, such as Boyle's law about the inverse relation of gas volume to pressure. Now when we look at theory, what is theory? Theory is a statement or set of statements derived from facts, laws, and confirmed hypotheses, such as the cell theory, the fluid mosaic theory of the membranes, and of course our sliding filament theory of the muscular contractions. Now the term law and theory, they have different meanings in science and in common usage. Now a law of nature is a description, and laws do not govern the universe. Now scientists use the word hypotheses for what in common use is termed as a theory. Now different usages can be confused when people conclude that something like the evolution is just a theory, making some type of guess or conjunction. Alright, so let's look at origins and adaptations. You should know who Charles Darwin is. Now the cell theory and the theory of natural selection have broad implications for human origins and of course understanding the human body. Now Charles Darwin's book on the origin of species of means of natural selection, it presented the first well-supported theory of evolution. He also wrote in 1871 The Descent of Men, and it addressed the issues of human evolution, anatomy and behavior, and relationship to other animals. Now when we look at theory of natural selection, is basically how species originate and change throughout time. Now the change is prevailing new of other origin, nature, and our place in the universe, and it increases our understanding of human form as well as function. When we look at evolution, what is evolution? It means the change in the genetic composition of a population um, of an organism or of organisms. Now we deal with the development of various bacterial resistance to antibodies, and of course the appearance of new strains in the AIDS virus. That's basically things that are evolving. They've had one strain, all of a sudden maybe it may appear 20 years later and it's a different strain. So that they're trying another virus, another vaccine to try and treat that particular strain. We deal with natural selection. That's the principle of theory of how evolution works. Now, some individuals, they have hereditary advantages over competitors. That's going to allow them to produce more offspring, thus increasing their characteristics in a particular population. Now, selection pressures are forces such as the climate, predators, disease, competition, and of course the ability of food. That deals with our selection pressures. We deal with adaptation. Adaptations are features of an organism that have evolved in response to selection pressures. Now we deal with the DNA. The DNA of humans, it has a difference of only 1.6% compared to that of like chimpanzees, based on the basis of hybridization studies and other evolutionary relationships to other species. It makes possible the testing of drugs on other species, especially those considered closer to us. Now, an animal species selected for research on a question is termed a model. So we use rats and mice, and those usually extensively due to issues involved with using chimpanzees. So we don't use chimpanzees anymore, just rats and mice. I'm gonna move ahead. And go ahead to slide 38. Go ahead to basically the structure, the human structure. Now, the humans exhibits a hierarchy of complexities when it comes to body structures. Now, the organism, when we deal with this hierarchy, starting from the highest to the lowest, let's see there, yeah, sorry, to the lowest, where atoms should be here as well. We're looking at organisms. We look at organisms. Actually, no, let me start from the bottom. We start with atoms. Atoms are there at the bottom of this particular hierarchy, and it's the smallest particles of matter that have unique chemical identities. So you're looking at the hydrogen atom, the phosphate atom. You look at that periodic table, those are the individual atoms that they're referring to. Now when you put two or more of them together, they form what? Molecules. So here's our molecule. You will have like a water molecule with H and two oxygens, H2O. Alright, so when we have more of these molecules put together, we form organelles, or these macroorganelles. You form macromolecules, sorry. And these macromolecules, such as the DNA, they will form our organelles. These organelles, such as this is our mitochondria, our lysosomes, our endoplasmic reticulum, smooth and rough, the cytoskeleton, the nucleus. These are the various organelles that they're referring to. And these organelles, they form what? They form cells. Different types of cells that we have. We have muscle cells, tissue cells, but they form cells. And these cells, when combined together, they will compose. They will make tissues. So now we're looking at skeletal tissue, muscle tissue, tissues, various tissues that you find throughout the body. And when you combine these tissues together, they form organs. And these organs, what kind of organs do you have? You have the stomach, the heart, the lungs, the kidneys, spleen, gallbladder, the intestines, large and small, eyes, skin. So there's various organs that we're talking about. Now these organs, when you put them together, what are we going to have? We have various organ systems, such as the muscular system, skeletal system, lymphatic system, urinary system, digestive system. Those are the various systems that we're referring to. Now when we put all of those systems together, it forms an organism, which is us, or an animal. Okay, so that is the hierarchy of complexity. So make sure you know where it starts from the simplest to the most complex, or maybe from the complex to the simplest. So make sure you understand the particular order of this hierarchy of complexity. Now let's look at reductionism. Reductionism is a theory that a large complex system can be understood by studying its simplest or the simpler components. Now, reductionism has been a highly productive approach, but is not the last word in understanding human life. Holism is a theory that whole organisms have emergent properties that cannot be predicted from the properties of their component parts. Human beings are more than the sum of these parts, more than the sum of their parts. And to be most effective, healthcare producers must treat the whole person, not just the disease or the organ system. So if you are suffering from, or if an individual is suffering from lung disease or some type of pulmonary disease, they're not just going to treat the lungs, but they're also going to treat maybe the heart as well, because they do work in conjunction with each other, and then as well as other parts of the body. If it's the heart, you have to think about the other parts of the body. Even if it's diabetes, you know that it's going to affect the various parts of the body, such as the eyes, such as cataract or glaucoma. They might suffer from poor circulation just because of that disease. So you have to treat the body as a whole, not just in parts. Alright, so let's look at no two humans are exactly alike. We already know that everybody has different fingerprints. Every single person in this world has a different fingerprint. And we're looking at anatomical variations. So it's very normal, and reference books and materials usually provide only the most common form based on 70% of the population. Now some people lack certain organs, such as certain muscles, and some people will have variations in structures, such as let's say 4 or 6 vertebrae instead of lumbar vertebrae instead of 5, or a difference in the number of kidneys, or the morphology of it. So some may just have one kidney, or one may be situated in the pelvic region called the pelvic kidney, while the one on the right, the left, is situated in the correct position. Or you may have a horseshoe type of kidney. So everybody is slightly different. Or we have or look at the heart. We have the various branches of the aortic aortic arch. Here's a normal one, but then you have various branches. Okay. Yep. All right, so let's move on. What are we going to look at now? Negative feedback and homeostasis, positive feedback. Those things we're going to discuss here. So we have some terms that we need to address. We have organization. What is organization? Living things exhibit they exhibit a higher level of organization than the non-living world around them. Right, so we're going to go through all of these functions. These are considered to be human functions. So life is characterized by several properties. So these are the properties of life, or characteristics of life. What are they? I'm going to go through them first. I started, but let's go through them. We have the organization, we have cellular composition, metabolism and excretion, responsiveness and movement, homeostasis, development, reproduction, and evolution. There's eight properties. So the first one I already talked about, but I'll go over it again. We talk about organization. That's dealing with living things. They're going to exhibit a higher level of organization than the non-living world around them. We talk about cellular composition. Living matter is composed of cells, of more than one cell, one or more cells. And look at metabolism. Metabolism, looking at some of all the internal chemical changes, such as anabolism, catabolism, and of course with excretion, because we already know that things in molecules from the environment, they're going to change them. They're going to excrete these particular molecules that can no longer be used, and that's where we have the metabolism come along, which is the sum of all these chemical changes, and they're going to comprise of anabolism, catabolism, and excretion. Anabolism, hopefully you guys know, but I will just remind you, anabolism is basically dealing with the synthesis reaction. That's putting things together. Like you have an atom, we have the water molecule, where we have the hydrogen and the two oxygens binding together, things coming together. Catabolism is basically breaking them apart, the breaking off of these molecules, so you have hydrogen floating around and two oxygens floating around. It's catabolism. And then with excretion, that is basically required to move any type of waste that's produced by this metabolism. Alright, so then we have responsiveness and movement. So we know that organisms, they can react to various types of stimuli and are capable of moving. So if it's too hot outside, you start to move, you start to shiver. If the doctor hits the patella tendon, you have a reflex jerk in your knee, in that seated position with your knee in a 90-degree angle, a joint 90-degree angle. So what's going to happen, you're going to sense it, and then you're going to react to the particular stimuli. So you're going to have responsiveness, you're going to have irritability and excitability. Now most organisms can move from place to place, or at least are capable of moving materials internally within their bodies and with cells. So here we have the remaining four. We have homeostasis. What is homeostasis? Basically, being able to maintain stable internal conditions within normal limits. I think that should be put in there, within normal limits. So basically homeostasis is trying to make sure everything stays normal. So at the end here in your notes, make sure you have maintaining relatively stable internal conditions within normal limits. We will see that again, because if it doesn't have that, then it's slightly incorrect. When you get a little further up in the science field, you'll see it will say within normal limits. Now we would deal with development. Development is any change in form or function over an organism's life. We have reproduction. Reproduction, basically producing copies of yourself, passing genes to your offspring. Then we have evolution, and that's dealing with mutations and things. So we have all things are going to exhibit genetic change from generation to generation, and therefore, of course, we're going to evolve. We have things called mutations, where we have changes in the DNA structure, and we have selection pressures, and that means that some individuals will be more successful than others. They may be able to jump higher than others, may have developed in various areas more than others. Okay. Alright, so let's look at physiological variables that are going to differ between sex, age, diet, weight, and of course with physical activity, environment, and so forth. So we have certain physiological values. In reference to a man, they say at age 22 that he may weigh approximately 154 pounds. He may occur when some light activity. So now we're not talking about light activity, maybe just be walking, slight run here and there, but nothing like a basketball game, competitive. That's not considered light. But he should consume approximately 2,800 kilocalories per day. Now for a woman, in reference to women, should be the same as a man, except we should consume 2,800 calories per day. Sorry, we should consume 200 kilocalories a day if we are participating in light physical activity. We're still age 22, but we weigh 128 pounds. Now, failure to consider variation can lead to over-medication of elderly or medicating women on the basis of research done on men. So we do have various values, like when you go to the doctor, that have certain values. Especially you take your child to the doctor, or you take your child to the doctor. They look at various values to see, are they overweight, are they underweight, if various things are normal within them. And then they may prescribe various things, change in their diet, physical activity, just make sure they meet the norm. Maybe you need to increase in calcium levels or intake dietary foods. Sorry. All right, so homeostasis. Bringing up the word again. So if I'm bringing it up this many times, you know you will see this word again. Homeostasis, the ability to maintain stable internal conditions, and it is accomplished by the body's negative feedback mechanisms. Of course, you're maintaining these internal conditions within normal limits. Now, Claude Bernard, he's very consistent internal conditions regardless of external conditions. So he's the one that basically came up with the idea or the theory that our body has to stay within our normal internal conditions, have to stay within certain limits no matter what the external environment is. And the body's going to fight to keep it at that level no matter what. Even if it means losing a limb, your body has to keep everything at normal limits. And that's what he was referring to. Just like if it's too cold outside, if it's too cold outside, what's going to happen? Your body's going to sense it. We'll get to that in maybe a little bit later, but still, the body is going to sense it and is going to detect that it is too cold outside, and it's going to reroute the blood to the various internal organs, so you have less blood going towards your extremities, and that's why your fingers get cold, the tip of your nose may get cold, your ears, your toes, those get cold first, because what the body's doing is getting into survival mode, and it will lose a limb. It'll rather lose a toe, lose a foot, fingers, instead of losing your heart, your lungs, your kidneys. It wants to preserve those. And that's basically dealing with sacrifice. And this is what this individual, Claude Bernard, was referring to. The internal body temperature ranges from 97 to 99 degrees Fahrenheit, despite variations in the external environment. So your body's going to do whatever it has to do just to keep it at those, or at that particular temperature. Now Walter Cannon, he did coin the term homeostasis. So the other one talked about it. This one decided, I'm going to call it homeostasis. The state of body now the state of the body, it starts to fluctuate, which is called dynamic equilibrium, and it's within limited range around a set point. And that's why I was telling you that when you look at the term homeostasis, the definition, the ability to maintain stable internal conditions within normal limits, or maybe a set point would be fine, but within normal limits. That's what it's talking about. It has to stay within a certain range, between that 97 to 99, that particular range. And we have negative feedback that helps with keeping it within that nice range. Now, loss of homeostatic control, it causes illness or death. So if your body temperature goes up, if you have a fever, your body goes, your internal temperature goes above 103, 104, 105, then you know it's causing it can cause brain damage as well as death. And if it goes below the 97, it can cause hypothermia and necrosis of the various tissues, and of course death of those, and of course death eventually if you're stayed out there too long in the cold. So let's look at our negative feedback. Negative feedback is a process in which the body senses a change, and then it activates a process to reverse it. Okay. So let us take this, for example, this beautiful thermostat. Here we have this thermostat that's controlling the room temperature. Here's our thermostat. Alright. This is an example we're going to use for negative feedback. Now the thermostat is set at a particular temperature. Okay? And that will be our set point. Now the furnace turns on when the temperature drops too low. So we're dealing with around maybe this in the winter time, or close to the, or maybe deep into the fall season, where you need to put on a little bit of heat because it's a little chilly outside. So we have the thermostat. You set it at a particular rate, a particular temperature. Of course, not to ensure that you don't have a high electric bill, but you have it at a set point that will actually kick on when the temperature drops. So that's where we talk about the furnace is going to turn on when the temperature starts to drop too low, and then it's going to turn off when the temperature raises above that set point. So after it senses that the room is warm enough, or at that particular point it's supposed to be, it will shut off. Okay? Right. So it's going to generate that heat, get the temperature up to where it's supposed to be, then the furnace shuts off. So when the temperature gets cool again, what's going to happen? The thermostat's going to shut on again. And it's going to continue that cycle for as long as you have it set at that particular point where you want it to shut on and off to regulate the heat or the temperature within that room. So that is our negative feedback. Negative feedback, again, is a process in which the body is going to sense changes, and then it's going to activate a process to reverse it. It's too cold in the room, the furnace shuts on to heat up the room, and when it's heated enough, it's going to shut it off. That's how our body works as well. So here's just another example of this negative feedback using this type of diagram. So we have our temperature, our room temperature here in Fahrenheit. We have our time running on the horizontal bar here. So here we have our set point. We have approximately a 68, but it's not going to stay there. It's obviously going to average around 68. It could be 68.1, 68.2. We're looking around that particular average. So what's going to happen when it's too cold, the furnace will turn on till it gets up to about 70. When the room feels warm enough, then it'll shut off. Of course, the room will get cold again. If outside's still cold, it'll shut off. And then turn back on when it feels it's turning too cold, when it's gone below that point. It's around the area now, around 68. It feels that it's too cold in the room. Sorry, it turns on. And then it turns off again when the room is nice and hot again. And then turns on. So this is off, and this is on. Sorry, I'm just mixing it up again. This is the furnace turning on, because it senses that it's too cold. So it will turn on to heat up the room till it gets about 70. Heating up the room, and then it'll shut off. Right? It's just about our time. Room is still warm, cooling off. All of a sudden it gets cold, and it shuts back on. And that's the type of wave that we have here when we deal with negative feedback, on and off, on and off. And that's just how our body works. So here we have another one with negative feedback, dealing with outside, dealing with our bodies. How does our body deal with if it's too cold outside? But here we have the same thing. First we dealt with the thermostat or the furnace. Now we're dealing with us. How does our body deal with it? Now if it's too cold, what happens when it's too cold? Our body, well, let me start with it's too hot. If it's too hot, here we have our body set at a particular, our internal thermostat is basically at 98.6 degrees Fahrenheit and 37 degrees Celsius. Now if it's too hot outside, summertime, our core temperature will increase. And what happens? We start to sweat. We have vasodilation. What's vasodilation? Vasal basically is talking about the blood vessels of your skin starting to dilate. They start to open up so that we can start sweating. We have more blood flow to the skin, causing you to sweat. That's our vasodilation. And that sweating helps us to cool off. Alright? So if we're in a different situation where the temperature changes, like it does around the fall area, 1 minute in the morning it's cold, and starting in the evening, in the midday it's hot, then it's cold again when it gets in evening time. This is the type of situation I can use for this particular example. So now it's cold, it's getting chilly. What's going to happen here? Person's going to start shivering. So your blood vessel, the blood that was in your extremities is now rerouted, mainly rerouted, still a little bit blood, but not all of it, has slightly rerouted and going to the core, the muscles within your core area, on your torso, and you start to shiver. You have vasoconstriction, where your blood vessels have closed down, or basically shut, allowing less blood in your extremities, and you start to shake, you start to shiver, and that's just to make sure you have enough heat generating to keep you warm. You might rub your hands together, but you shaking is just to keep you warm. So those are the various things that are going to happen to negative feedback to try and get your body back to this particular set point, to get it back to homeostasis. If it's too hot outside, you have vasodilation and you start to sweat. That should hopefully bring us back down to our set point. And if it's too cold, we have vasoconstriction, as well as we start to shiver to try and get this temperature back to normal. Alright, so we have postural changes when it comes to the blood pressure. And how does that work? Alright, so here we have an individual. Here we have an individual that was just lying in bed. Now when you're lying in bed or just lying down, your blood is circulating throughout the body evenly. There's no gravity coming into play where it has to work harder to try and get the blood for venous return. I'm sorry. So now this person is out of bed. They stand up, time to get to work. What happens? We have an imbalance of the blood of the blood flowing throughout the body. So now the blood is going to drain from the upper to the lower because we're standing. So now the part has to work harder to push that blood back. Well, we have an increase of venous return because it has to get back to the heart, and it's fighting against gravity. So of course, at the time, we have these receptors within different areas of the heart is your aortic arch. So you have these various receptors that are going to sense that the blood pressure has dropped, and it sends those signals to the brain. So once these baroreceptors sense it, it's going to send the signals to the brain, or to the brain center where it has the cardiac centers, which basically deals with just the heart functioning. And the brain is going to send those. The brain is going to receive the signals from the baroreceptors, process the information, and then it's going to issue a command telling the heart to increase, so that we can increase this blood pressure to normal levels, so that we can have homeostasis again. Okay, this is just another example of our negative feedback loop. Here's just the written portion of what I was just talking about with the baroreceptors. Okay, I'm gonna keep going. Oh yeah. Also, in some elderly, when they get up, that feedback doesn't work properly. A lot of people, they may get dizzy. Some people might have vertigo, or that can also play a major role in dizziness when people get up in the morning. That's why they always tell you, make sure you take your time and get up, and that's to make sure you don't have a sudden drop in your blood pressure that can cause you to get dizzy or faint. So what they'll tell you to do is, instead of getting up quickly and running out to the restroom or out of the room, slowly get up, sit at the edge of the bed and sit for a minute or two, and then stand on your feet and start your day. And that's just to make sure that your that the blood is not being rushed out and causing your blood pressure to drop. Alright, so when we deal with still with our homeostasis and our negative feedback, we have receptors, we have an integrating center, also called our control center, and we have our effectors. When we look at the receptors, they're the ones that are going to sense the change in the body, such as the baroreceptors. You have receptors in your skin. Also, you have chemoreceptors that deal with the various changes in the hormones and stuff in the body. But we have these that are going to detect any type of change that's not normal. Hey, it's too cold outside. Wait, my heart's beating too fast. Hey, guess what? The blood pressure dropped. We've got to react. So those signals are then sent to this control center within the brain, within the brain stem, for processing. When it processes, it's going to send that information out to the various effectors that are going to make that final decision. Hey, you know what? It's cold outside. Let's start shivering. All right, muscles start to shiver. Or if it's too cold, or if it's too hot outside, time to vasodilate. Open up the blood vessels. It's going to tell whatever muscle or whatever organ to do something so that it can get back to that homeostatic level or state. All right, so let me talk about positive feedback. It's a self-amplifying type of cycle. And positive feedback, a physiological change that leads to an even greater change in the same direction. So that's the difference between positive and negative. The negative deals with the opposing response. The positive feedback deals with having a greater change in the same direction. Now, the process of childbirth, is an example of the positive feedback loop. And we'll go through that example in just a second. Now, a normal way of producing rapid changes, of course, we have childbirth. There are some examples: blood clotting, protein digestion, fever, and generation of nerve signals. Now, during childbirth, what happens there? Let's read it through, and then I'll go through it again. Now, during childbirth, the head of the fetus is going to push against the cervix. It's going to stimulate the nerve endings that are there. We have this particular hormone called oxytocin that's going to be secreted by the pituitary gland. And when this oxytocin gets to the uterus through the bloodstream, it's going to stimulate contraction. Now, this stimulation obviously is going to cause the fetus to be pushed downward toward the fetus, and it's going to keep stimulating the cervix. It's going to push the fetus downward towards the cervix, and it's going to keep stimulating that cervix even more and more and more and more. So you're going to have more oxytocin being secreted. It's going to cause that positive feedback to be repeated over and over again. And that means oxytocin is going to secrete each time. Here's just an example of what it is. Here we have the head of the fetus pushing against the cervix. We have the receptors here within the cervix saying, hey, something's pushing on me, it needs to come out. We have the oxytocin, the stimulus is being sent to the brain. The brain receives it, processes it, and sends a response back. Alright, troopers, what are we going to do? Come on, oxytocin. Pituitary gland, secrete your oxytocin. Pituitary gland does what? Secretes oxytocin, sends it out through the bloodstream to the cervix, causing the cervix to contract, and the baby starts pushing against it anymore. So hey, something's pushing against us. Secrete some more oxytocin. Start secretion. That's where we have our uterine contractions. Okay. Alright, so also with positive feedback, it may be harmful or threatening and affects the loop, which pushes the body too far from homeostasis. So it can cause the body to go into life-threatening situations. And now, a fever is a huge example of that. Fever is basically greater than 104 Fahrenheit. Now, if the body reaches above 104, it's considered to be temperature reaches above 104, then it's considered to be a fever. Now, the metabolic rate, it starts to increase, which is going to cause the body's temperature to rise even further. Now, the cycle continues to reinforce itself. Of course, it's very fatal when we get to 113 degrees Fahrenheit. Now let's look at the language of medicine. Now when we look at the language of medicine, and also a lot of information in this chapter, this is the last section. But when we look at the language of medicine, this is briefly talking about medical terminology. So hopefully you guys have taken medical terminology prior to this class. It will be very useful in helping you understand and remember various terms. Alright, so when we look at terminology, it's coded in the terminological, the TA, I'll pronounce it as the TA, Anatomica. And it's coded back in 1989 by a set of professional associates and course of anatomicists. Now, there's about 90% of the medical terms are formed from just 1,200 Greek and Latin roots. Now, of course, some structures were given certain terms that are coined or named from various people. Now, scientific terms are typically composed of one or more of the elements. We have roots, we have combining vowels, we have prefixes, and we have suffixes. When we look at the roots, that's basically the core meaning. The combining vowel is that vowel, either A, E, O. O is more common, that we use to combine these root words together. Then with prefix, basically that's what comes prior to the word, and the suffix is what comes after the word. Alright, let me see if I can give you guys an example. Let's see if I can write it down here. Uh-oh. Where's the glue? Alright, so we're going to look at, let's see if it works. Cardiology. I like to study the heart, so I'm going to use cardiology. Alright, so when we look at cardiology, it would have a root word. And it has a, let me get this out first. Alright, so here's our root word. Then we have our combining form. Then we have our suffix. Each of these means something. Cardi, meaning heart. O, it's just the O. And then logy, it talks about the study of, which gives us the whole word, the meaning of the word, the study of the heart. Alright, so we have acronyms. Acronyms, they're formed from the first letter or the first few letters of our series of words. So we have calmodulin, which comes from the phrase calcium modulating protein. Calmodulin. And we have these various words of talks about prefixes, not prefixes, of plural forms. And when you get into medical terminology, you're gonna have to know the singular form as well as the plural form. For example, we have diagnosis. Diagnoses is more than one. We have sarcoma, all those ending in MA. Sarcomata, meaning more than one. Septum, dealing with one. Septa, dealing with two. So the heart has two septa, but it has an interventricular septum and an interatrial septum. Okay. And those ending in US, these are tricky. These you have two that are ending in S, but in the plural form, it'll either end in an I or ORA. And all these just deal with memorization. Your villus, singular, plural will be villi. Your corpus will be your corpora. And then your phalanx, which are your digits. Your phalanx is your singular. Your phalanges is dealing with more than one. Okay, so these are just very singular endings, and knowing how they change over the different types of endings you'll have when it's talking about your plural form. Okay, and we have some type of words that have adjectives to it, talking about your digitorum, dealing with multiple fingers or toes. Your digitus, your digits, like I was talking about your digits, some of your fingers and your toes. Your digiti, which is a single toe or your finger. Then we have a brachii, which deals with the arm, or your brachum also deals with the arm. There are three examples of positive, comparative, and superlative degrees of comparison, and that's when we're dealing with sizes. Okay, For example, when we talk about large, larger, and largest, in Latin you deal with magnus or magnus, major, or maximus, minimus. Okay. For example, gluteus maximus, gluteus maximus, gluteus medius, gluteus minimus. Those are talking about. Those are a few examples. And you have pectoralis major and as well as pectoralis minor. Now we do pronunciations. You see without my videos, pronunciations, it comes with a lot of practice. But of course, depending on where you're from, you may pronounce various things differently. From a different country, you may pronounce things slightly different. Okay. Some pronunciations is very important part of the anatomical terminology. Simple pronunciation guides are given at this particular website, so I do suggest you guys go and check it out so you can get various pronunciations of the anatomical terms. Now, it's very important for precision. You must be precise in your terms. You must spell things correctly. If you ever take my class on campus, not online, I do count spelling. I will dock you for spelling because spelling is very important. It's a life and death situation, is what I consider it to be. Now, healthcare professionals, they demand the same type of precision. If you're talking about the fingers, make sure you use digits or your digitum or your phalanges or your phalanx. You have to know, of course, the different parts of the phalanx. You have a posterior, you have a distal, a proximal, and you have a medial. You have to know what these things are. It's very precise with what you're doing. If someone's giving you a diagnosis or they're asking you to give intervenal support to a patient, and they're telling you this is the amount you need to give, you have to give that amount. Don't give more, don't give less. Give that certain amount of cc's to that individual. Everything is very precise. Make sure you write what you know, write what you see. It can get you fired and it can kill a patient. Now, review of our major terms. We have cell theory. What is cell theory? All structure and function results from activity of cells. What's homeostasis? The purpose of most normal physiology is to maintain stable conditions within the body within normal limits. Evolution. The human body is a product of our evolution. Hierarchy of structure. The human structure can be viewed as a series of levels of complexity. Don't forget, from simple to largest, we're dealing with from the atoms all the way up to the organism. Unity of form and function. Form and function complement each other. And of course, physiology cannot be divorced from anatomy. Okay. These are just the various types of imaging. I'm not going to get into that right now, but I would like you guys to start reviewing because you will have a quiz or a test coming up very soon, and I will make sure I post a very small study guide for you. It is a lot of information, so start making your own notes. Alright, so I will see you guys later. We stopped at slide 69. Alright, so make sure you guys do your review. If you have any questions, make sure you post it for me on Blackboard.